Great. Welcome back to the House Healthcare Committee. We are now transitioning to our next compact, which is H86, an act relating to Vermont's adoption of the Audiology and Speech Language Pathology Interstate Compact. We have Tim back with us, Legislative Counsel, who will again walk us through a summary, which can be found on the committee page. So go for it, Tim.
Thank you very much, Chair. H86, an act relating to Vermont's adoption of the Audiology and Speech Language Pathology Interstate Compact. H86 would enter Vermont into the Audiology and Speech Language Pathology Interstate Compact, or ASLP Compact, or even further abbreviated ASLP-IC, as amended by its commission, known as the ASLP-IC Commission. And just before going too much further into this, I just want to point out that this will structurally sound very familiar.
Okay.
So just kind of bear with me.
Sure.
There are currently 23 states in the compact, including New Hampshire. By entering the ASLP Compact, Vermont agrees to mutually recognize other member states' audiologist and speech language pathologist licenses, as well as rules promulgated by the Commission. By enacting this bill into law, Vermont would essentially be entering into a contract with other states that are parties to the compact. Therefore, the compact provisions of the bill cannot really be amended. The ASLP compact provisions, however, may be supplemented with provisions for Vermont's implementation and administration of the compact, so long as those provisions are not inconsistent with the compact. The ASLP compact contains the following main provisions. First, state participation in the compact. Each participating state must, among other items, 1, require criminal background checks using FBI records check results. 2, use the compact data system. 3, follow certain educational requirements for licensure and renewal. And 3. That's the other list. Next main point, compact privilege. An audiologist or speech language pathologist may practice in each state that is a party to the compact. These are referred to as member states again. Next featured item is requirements for licensure and compact privilege. An audiologist or speech language pathologist is licensed by their home state, that is, their primary state of residence. To qualify for compact privilege, an audiologist or speech language pathologist's primary state of residence must be a member state. An audiologist or speech language pathologist must meet the home state's qualifications for licensure, which at a minimum must include criminal background check and meeting educational exam requirements. An audiologist or speech language pathologist must have no encumbrance on any state license within the 2 years prior for applying for licensure, regardless of whether the state is a member or not. And that's a little bit of a difference from the last compact we were examining earlier.
So can you say that again?
Sure. Just repeat this line. An audiologist or speech language pathologist must have no encumbrance on any state license within 2 years prior to applying for licensure. It adds a 2-year temporal window as well.
That's what, and how is that different than the other one? Just
I believe didn't have the 2-year window.
Okay.
So it's just if it's encumbered at the time you apply, or so there's not that history of encumbrance that's being considered.
Okay.
Next main point of the compact is compliance with state laws for practicing. When an audiologist or speech language pathologist is practicing in a member state, the audiologist or speech language pathologist is required to comply with that state's laws. Next main point, discipline of audiologists and speech language pathologists. Home state shall have exclusive power to discipline and impose adverse action against the license issued by that home state. This includes the ability to discipline based on factual findings of another member state. If a home state disciplines the audiologist or speech language pathologist license, the audiologist or speech language pathologist's ability to practice under the compact license is suspended until all encumbrances have been removed from the home state license. A remote or non-home state member state has the authority to take adverse action against the audiologist or speech language pathologist's privilege to practice within that remote or non-home member state. A member state's decision that participation in an alternative program may be used in lieu of, sorry, rephrase that point. A member state's decision that the participation in an alternative program may be used in lieu of adverse action. Next main feature, compact licensure data system. Member states are required to share licensure information, including any disciplinary actions, in the compact's coordinated licensure information system. Next main point, Audiology and Speech Pathology Interstate Compact Commission. Again, this is the ASLP-IC Commission. Commission promulgates uniform rules to facilitate and coordinate implementation and administration of this compact. These rules have the full force and effect of law and shall be binding in all member states. Each member state has 2 delegates on the PT Commission, one an audiologist, the other one is a speech language pathologist, and the state licensing board, in Vermont's case, the director of the Office of Professional Regulation selects the delegates. There's a slight variation well from the other compact where they have 1 delegate. This affords 2 to each member state. Withdrawal from the compact. State may withdraw from the compact by repealing the enabling law, but the withdrawal does not take effect until 6 months after that repeal, and the state must comply with the compact terms until that time.
Very similar.
Harry.
Marty?
I'm curious about whether that 2-year encumbrance window came from the commission, or where did that language come from?
That is the rope compact language. I'm not sure exactly the policy decisions behind that. The materials I had reviewed didn't really speak to the intent as to what the aim was. I apologize, I'm not too sure.
Right, so I'm not sure if it came from the audiology and speech pathology advocates in this state, or if that's a requirement of the national compact.
National compact, sorry.
Gotcha.
Okay.
Thank you.
Daisy?
I apologize because I know someone has asked this question before, but I'm going to ask it again.
Sure.
Under discipline, second bullet, this includes the ability to discipline based on the factual findings of another member state.
Mm-hmm.
Factual findings indicates to me that there has been some sort of proceedings to determine that they are factual. Who pays for those proceedings?
I do not know off the top of my head. I can defer to folks at OPR. I can also take another look offline.
I think we have OPR raising their hand. So, Lauren?
Yes, Lauren Hibbert, Deputy Secretary of State for the record. We take the cost of discipline across all of our professions. We divide it by the number of disciplinary cases in each profession, and we allocate that to the specific profession. So the costs of the space for the enforcement unit, the salaries for the enforcement unit, all of those costs, we divide it by the number of complaints that we receive and the number of prosecutions that we take. And then we allocate it to the professions based on how many complaints we received in each profession and how many prosecutions we did in each profession. It's a relatively complex allocation formula.
Thank you.
But who actually writes the check?
The Office of Professional Regulation.
So that's part of your budget.
It is, it's part of our budget.
May I add to that? Lauren Lehman, for the record. If the discipline's happening out of state, say in another state, I'm not gonna use the state we're using. So the person's disciplined in the other state and there's facts findings that we are then assuming and doing a prosecution based on those facts in Vermont. The cost for the initial investigation will be paid for in that state. And then if we pursue the investigation here and discipline here based on their facts, it would be out of our budget.
Okay, that makes a little more sense based on this language.
So we would just assume the facts finding rather than doing our own fact finding is what that allows.
Okay. Tupper?
Yeah, I'm trying to find it right now. It's on page 2.
Page 2 of the summary.
Right. It talks about the compact data system. And I'm wondering if we are using that system now.
Currently, we are not using that system.
Okay, so is that a major cost for us to stand up that system?
It will not be a cost for us to stand up the system because it's web hosted. It will be a training cost of our team, and that's partly why we would ask for a longer implementation date, is so that we can get all of our ducks in a row before we have to start using it. But we wouldn't have to host or implement the software system that they're talking about, but our team would have to interact with the system. We'd have a login into the system, and we'd be using it to check our licensees and to submit our discipline into it.
So Art, I know you have a question. Is the question around the legislation? Because if not, then I'm going to let Tim leave the seat and bring up Lauren and Lauren. So is your question for Legislative Council or OPR?
A little bit of both, I think, Lori.
Okay, well, we're going to go with it then, but
My question,
Go with it.
you're hard hitting. Just that I hear two things here. I see it as an audiology and speech language pathology, and then I see audiology or speech language pathology. And I'm trying to understand if you offer licenses for both, or is it one license?
There are two licensed separately, and there are, under our Vermont's current law, audiologists are one license type and speech language pathologists are completely separate licenses.
But the compact is for both.
But the compacts for both they negotiate together.
Okay.
thank you. Any other questions on the bill itself for Legislative Council? Great. Thank you very much, Tim.
Thank you.
Hey, Lauren and Lauren. I know
I'm laughing every time.
It's good every time.
every time.
Lauren Square.
Lauren show.
You could take it,
Right.
live, right? Actually, we are live. We actually do. It's true. We are live.
For the record, Lauren Hibbert, Deputy Secretary of State, and with me I have
Lauren Lehman, General Counsel for the Office of Professional Regulation.
And we have remarked that we spent many years of our young life not knowing other Laurens.
And here
And
you
here we
are, right?
Yes.
Wonderful. Making up for lost time.
Exactly. So I'll just again do the high level on the audiology and speech language pathology interstate compact. This is another compact that is more fully baked than the interstate counseling compact. It does have multiple states in it, 23, including New Hampshire. New Hampshire's almost, you'll notice the theme, New Hampshire's pro-compact,
Yes.
has been pro-compact for many years. And then outside of New Hampshire, there's not that many states in the compact right next to us, which is just something that we look at when assessing whether or not it's right for us to join. Because we are a small state, we know that people travel across our borders to practice. And for our New Hampshire border, the compact makes sense, less so for our Massachusetts or New York border. In this compact, the compact privileges have not yet been issued, but they plan to be in this year. I'm not sure which month of this year, but
End of this year is
The
what
end
the
of-
state says.
the end of this year. So right now, this compact is operable in all of those states, meaning it's enacted and people are starting to get ready to do it, but you can't actually use the license until the end of this year.
So of all the three we've talked about, the only one that is actually in use is the physical therapy one.
Correct.
This one seems to be a little bit further along than the counseling one.
That is correct.
Okay, great.
By a matter of months. It's,
Okay,
so their commission is just recently started meeting, and so that's how they're.
great.
And they're in the middle of doing the bylaws and the rules. So they're ahead of the counseling compact in that as well,
Okay.
but they're still behind the PT compact.
Okay, great. Yes, please go sit on the other side. That's perfectly fine. Thank you. No, you're fine.
And with that, I'm going to turn it over to Lauren later.
Great.
Thank you, Lauren Hibbert. So some features. So this is similarly structured, but there are a couple of nuances that make OPR that make this one a little more challenging. So it's two professions, as noted, that are together in this compact, but are separately licensed under OPR. That's not really a complication. I think we can handle it, but it's two kind of separate issues in the compact. So again, it's a privilege to practice. You get a home state license in your home state.
You'd notify the compact, I want a privilege to practice in New Hampshire. You'd pay a fee to the compact and and then an additional fee for that New Hampshire state fee. The nuance in this compact is to be a participating state. So all compacts are structured with, here's what you need to be a member of our compact state. And then it's separately, what do you need to do as an individual SLP or audiologist to get that privilege to practice? So as kind of a condition to participate and become a member of this audiology and SLP compact, under that section, it has requirements for what the state needs to do to license audiologists in the state. We need to have some certain base requirements to license audiologists in order to be eligible to join the compact, which makes sense because other states are trusting our licensing process. In this compact, they have a higher requirement for audiologists to obtain a compact license than Vermont currently requires audiologists to obtain a Vermont license. The compact requires a doctorate degree to get that multi-state license. We currently don't require that in Vermont. So there's a question about how we make Vermont eligible to join the ASLP. I think OPR would be reluctant to encourage carte blanche increasing of the requirement to be licensed in Vermont to that doctorate level, because we have that Chapter 57 requirement, which I don't know we've talked a lot about in here. There's a statewide policy, the legislature has expressed its intent that a barrier to practicing your profession, a license is such a barrier, not be implemented unless there's found to be a harm to the public from unlicensed practice of that profession. So we need to find out that there's somebody out there who's practicing a profession unlicensed and there's a harm to the public of that unlicensed practice. Once we've identified that public harm, the type of regulation needs to be the minimum necessary to protect the public, to prevent that harm. We consider ourselves making professionals the least competent possible to protect the public. We're not making licenses do not ensure great competency. We assure they're not going to hurt you. So when we found that through analysis and the legislative intent that the minimum necessary for an audiologist, that any harm an unlicensed audiologist could present to the public, the minimum necessary was requiring them to have a master's degree. We are reluctant to then just amp that up to a doctorate degree and more education without evidence that master's degree level audiologists are somehow causing additional harm or that it's not harming the public. So that's why we wouldn't want to carte blanche change the Vermont laws to that higher requirement. That said, we'd be happy to, we agree with the goals of mobility, et cetera. So if there's a way for us, there might be a need for a separate kind of compact license requirements as part of this.
So just to clarify, so we could issue the compact license to the doctorate level folks and the single state license to the master level folks. But it is creating that distinction in Vermont law because we would have to, there would be some folks who would not be eligible for the compact license. And we haven't done that analysis of how many. We have done that? No, we have not.
Okay.
We have not done the analysis of how many of our current licensees would even be eligible for the compact based on the fact that they do not currently have a doctorate.
Okay. So Alyssa and then Leslie.
So I just want to be clear, the compact requires that only the applicants for the compact will have the doctoral degree, not our entire licensing. So
that's correct.
And it's actually a little confusing in the compact. The way the compact's written, it says for the state to be eligible to join, we need to have a law that requires the doctorate level. So it's not clear that we can just say, okay, but do it policy wise or rulemaking wise. We might have to have a statutory change to be eligible to join. I think that's a good question for the compact folks to see what they intended there.
Yeah, probably would have to do a statute.
So had they put that requirement in the audiology or the part where the individual is trying to qualify for their license, it would be clear that we could just make that distinction. But because they put it in the state eligibility section, it seems like we need a state law to even be eligible to join.
So that may be an amendment if the committee is interested in moving this compact forward.
Right.
But we would need to have a little time to talk with the compact commission and likely have an amendment to the eligibility section of the Vermont law that has a path for the compact license that would require the doctorate.
Okay. Good news is that this compact was developed by that Council on State Governments, the one that did the council, so they're very familiar and a great resource, so we will be able to
Okay,
talk to them.
okay, great. Leslie and then Art.
And you may not be the right people to answer this question, but I'm wondering what problem they were solving by requiring doctorates.
You know, I think that's a constant, I think it's about goals, and I think a lot of folks are looking to make that really excellent profession. And our mission is just different. Our mission is the minimum necessary to protect the public. And so they might, I don't want to speculate on theirs, but I've heard, this is what really, to be a really good audiologist, you need to have a doctoral level thing.
And we're seeing that across lots of professions. A lot of professions are having a creep of, and I don't mean that in a pejorative way, but in a more and more requirements to be eligible for the job or to be eligible for licensure in some states. And Vermont has really tried to make sure that we don't participate in that educational creep in large part because of the student loan debt that it incurs.
Art.
Yes, this is one field that I've had experience with it because I just recently got hearing aids and I dealt with audiologists. But this is a profession that like box stores and big companies have. Like I went to Miracle Ear, I went to Costco. They have audiologists. Now, do they have to get these compact licenses too, or how?
They do have to have, the person in Costco or in Miracle Ear has to hold a license in Vermont. And if they were a resident of another state and came in just for the day and this compact were operational, let's say they lived in New Hampshire, and this compact was operational, they would need the privilege to work here.
Okay. Now, another overall question I have, the more I hear, this is the third compact thing we've heard about. I get a license to be an audiologist in Vermont. I get the compact license, correct? And I get the license for the state I want to practice in too?
You get a kind of like your foundation license. So wherever you live is your home state, and you would get that home state license. Okay. Once you have that and these privilege to practice, you go straight to the Compact Commission and say, I want to practice in XYZ state. And then you pay them and they give you the privilege to practice in those states.
In those three states?
Yeah.
So it's only two things I need, here in the compact license. And I can name all the states in the compact, correct?
Yeah.
For no greater fee than one?
No, I don't know how, I think you have to pay a compact fee. I'm not sure if that's per state. So you pay, I think Michelle said on PT, it was $45 to the compact and plus whatever state fee it was. So, and those could range from 35 to 100 for PT.
Okay, so if you were going to practice in several of the states, it could be relatively costly to get those. So you're okay. I just want to get a sense of what this does.
But then again,
No, go ahead.
But then again, the rationale is then you're able to make money in all of those states.
No, I understand, but I'm wondering if a person, and just a hypothetical to understand, if I live in Vermont and I have the license, but I want to just, if I contact Florida, can I say, I want to get a license there too? How much is it? Just pay them and be able to work in both places?
That would still be available. You still could do that.
Okay, so you can still do those things.
Yes.
And the difference is the compact is set up to make it easier So if you are an audiologist and you go to Florida and say, I want a license here, potentially it's a much higher fee, potentially, than if you went through the compact. And you have to go through all the licensure procedures for that state, which could be quite expansive and time consuming. And so that's why these compacts are in place, to help cut down that piece of it.
Okay, so are we sure it cuts it down?
Yes.
Yes.
Okay, all right.
Well, I'm thinking, so a normal process might be getting a transcript, getting syllabi from your courses, taking in test scores. If you've been practicing for 20 years, going to your college and getting a transcript.
Okay, all right, yeah, I see.
Background
Okay.
checks.
I just want to see how this saves, because I hear us having to still shell out a lot of money to work it on the state. Like you say, you get it back, hopefully.
And you save money, like if you went to Florida to buy a license there, and to get licensed there, as the chair said, you would likely have to pay more for that home state license than for the privilege.
Okay, thank you.
And I just want to put a pin for this compact. I don't think the compact privilege, the fees have been established yet. So we can get that analysis done for the PT compact, but not for the SLP audiology compact.
Counseling.
Or counseling.
Right,
The other one.
that's the other one that are still, okay. Okay, go ahead.
All right, so that's the complication with audiology, is that kind of dissonance in the qualifications. Otherwise, it's the same: supervised practice, national exam, active unencumbered license. They do require that there never be a conviction or finding guilty of a felony related to the practice of audiology. And they require a background check. So again, we'd have to go through the amendment to adding them to that list of professions that we could perform a background check for. SLPs mirror the requirements for a Vermont license, are mirrored in the compact license, so that's good. I should note here that to practice in a school in Vermont, as an SLP, you need 2 levels of licensure. You need a OPR license, and you need a license from the Agency of Education. This compact, I don't know how, we can't speak on behalf of AOE and what they would accept in school practice.
So that what Lauren's saying is the agency may not issue the school endorsement for a school SLP based on a compact privilege. That would be something to talk about with the agency.
Would that same apply to PT or counseling?
For counseling, possibly. My understanding is the majority of folks in the school system are not licensed mental health counselors. They're in fact social workers. So if we were talking about the social work compact, I'd be more concerned about the agency's endorsement. But for PT, I don't believe any PTs are have the Agency of Education's endorsement.
Tapper?
Approximately how many people that are audiologists have a doctoral degree? Do you know that?
We don't have that analysis done. It would take us some time. We'd have to go into each educational record of each audiologist in the state. So that's not an easy answer. It's not something we've tracked before. So if you are interested in that, I'm sure confident we could get it for you, but I don't have the answer off in an easy way.
Okay.
So I think that pretty much includes everything. Our benefits are similar, mobility and the authority to practice via telehealth, especially in these professions, would be significant. We don't know whether access would be improved, although the telehealth access might actually improve access in Vermont. And the fees, again, it's unclear what the fallout there will be. And our concerns, I think I addressed as we went, just that disconnect between the qualifications for audiologists and for SLPs, just that.
Right, school piece, okay. And so again, understanding that there are a couple other issues here, if those can be worked out, does the Office of Professional Regulation support us entering into this compact?
Yes.
Great. Any other questions for Lauren? All right. Thank you very much. Now we will hear from providers. Susan, are you with us?
I am.
Hi, Susan. How are you?
I'm good. How are you?
Good. If you can introduce yourself for the record and then tell us your story.
Sure. So for the record, my name is Susan Adams, and I'm the Director of State Legislative and Regulatory Affairs for the American Speech Language Hearing Association. We are the National Professional Scientific and Credentialing Association for our 223,000 members and affiliates who are audiologists, speech language pathologists, speech language and hearing scientists, audiology and speech language pathology support personnel, and students. We have over 550 members in the state of Vermont. My apologies to Tim for not being able to come up with a better acronym for this compact. It is a mouthful, and I tried really hard. So this legislation is, in its simplest form, is a compact and a contract between states to recognize another pathway to practice. As mentioned, we have 23 member states right now, including neighboring New Hampshire. A bill has been introduced in New York this session. We expect a bill in Maine, and we know that Massachusetts and Rhode Island have also expressed interest, and we expect legislation from those states in the next year. So the compact is designed to allow audiologists and SLPs to work across state lines, both legally and ethically, without an individual obtaining a license in every state. It increases access to care for those with communication disorders, facilitates continuity of care when clients relocate or travel, and increases consumer protection by expanding the prosecutorial net for bad actors. The compact allows greater access to currently underserved and isolated populations, and it more easily allows military spouses to maintain their profession when they are relocating. You'll see that you have some written testimony from Melissa Willett, who is the Department of Defense State Liaison for Vermont. In her remarks, you'll see that the secretaries of the military departments have made the importance of military spouse licensure clear as they consider the availability of licensure reciprocity when evaluating future base or mission alternatives. The DoD views occupational licensure interstate compacts as the optimum way to provide for a streamlined licensing of service members and military spouses. There was some talk earlier about where we are in the process. So we are coming into operation. We have established 3 committees: the Executive Committee, the Rules Committee, and the Finance Committee. We have adopted initial rules and bylaws, and we are working with vendors currently to create that database so that we can begin issuing privileges. So that system is not yet created. I know there was a question about this, Vermont being able to speak to that system. We are going to have vendors working on that, and they will be able to work with each state individually to make sure that the systems can communicate with each other. So the elephant in the room question is the masters versus audiology question. So the compact and the majority of states have a grandfathering clause in the Practice Act for master's level audiologists to continue practicing. The audiology degree, the doctoral audiology degree requirement went into effect on January 1st, 2008, at which point there really were no longer any accredited master's level programs for audiologists. I don't believe the intent was to keep Vermont out of this compact based on the way that your Practice Act is written, and I'm happy to discuss that further with our compact council so that we can make sure that Vermont can indeed join the compact and enjoy those privileges. I know there was also questions about hearing aid dispensing and school practitioners. So the way the compact is written, the privilege to practice only gets you into the state for the state license. So if your state requires a separate certificate or license to work as a hearing aid dispenser or to work in a school requirement, you would still have to receive and maintain those certificates or licenses. If the state required both licenses, as Vermont does, we would hope that the privilege to practice would meet the health-based license, and then they would not have to get the actual license. They can use the privilege to practice as the license and then get the state the school-based credential. So I'm happy to answer any questions that you have. I know that you talked about the criminal background checks earlier with the PT compact, and we would be happy to work with OPR on dealing with that issue in Vermont as well. And I hope I can count on your support, and I stand ready to respond to any questions.
Great, thank you, Susan. And I just want to point out for the committee, Susan talked about Melissa Willett, who provided testimony. And just remember, she actually came in and testified on the counseling compact, and she asked to come back, and it was the same support. So I suggested she just write letters of recommendation, and so that's why we have. So it's the same person who came in and testified last week, I think it was. Or a month ago. I don't know. Who knows when it was? So does anyone have any questions for Susan Tupper?
Susan, can you just again talk about the doctoral requirement? And I think you said grandfather in Vermont people that only have to have a master's degree. Is that what you said?
So the way it is set up in most states, and the way it's set up for ASHA's Certificate of Clinical Competence and the compact, you can get a master's degree through December 31st, 2007. And at that point, anybody who got a new license would need to meet the AUD requirement, the doctoral requirement. There was a couple of reasons for that change. One of them was, there was a study done on the minimum requirements that should be allowed for an audiologist to practice, and those were decided that they were going to be the doctoral level to ensure that clients and consumers got the best care needed. And also, most of the master's degree programs had closed down. So there really isn't, I'm being told by my audiology practices team that there are no more master's level programs for audiologists. So any audiologist who has come out since 2008 should already have a doctoral degree. So we allow anybody who has practiced prior to that date to enter the compact, to get a state license in most states, and to get ASHA certification with that master's requirement. But after that, it was the doctoral requirement.
So we'll have to take note of that in our state and have, OPR work with the commission to see what would work best if we move forward with this. Any other questions for Susan? Great, thank you very much, Susan, and feel free to stay on or leave, whatever works for your schedule. And we appreciate your information. That was very helpful.
Thank you.
Great. Is Linda here? Hey, Linda, come on up. How are you?
I'm good. How are you?
I'm good. You can, once you get settled, just introduce yourself for the record and then tell us your story.
I'm Linda Hazard. I'm an audiologist. I also hold a doctorate in educational leadership and social policy. So I have a master's level plus a doctoral level. I am here personally, not representing either of my agencies, but I will explain that I am the program director that oversees hearing screening for the state of Vermont, diagnostic audiology for infants, and early intervention services, as well as oversight for some deaf and hard of hearing service, direct instruction for students, ESL bilingual programs. So I was happy to hear Susan explain the audiology piece. So I was one of those people that was a master's. I can probably provide by tomorrow, very quickly, the list of audiologists and master's level versus doctoral level. But anyone graduating now has a doctorate level. So today I briefly wanted to talk with you a little bit about some of the challenges that we face here in Vermont, especially around SLPs. I currently have 2 open SLP positions that we have not been able to fill yet. With our work in early intervention, we are seeing many children who need both evaluations and services, and we don't have the providers for those at this time. I can tell you one county has 79 children on the waiting list. And we have been trying to help address this in our current program because we support services for deaf and hard of hearing children in early intervention and are trying to expand. But again, finding speech and language pathologists has been definitely challenging. My world is deaf and hard of hearing children and students. We also have one provider in the state of Vermont who is certified in listening and spoken language as a speech and language pathologist. And having a compact like this would allow us to have services come in from other states, which would be really, really helpful at this point in time. Because, children often use ASL or, may use ASL, they may use listening and spoken language, they may use a combination of.
Can you just say what ASL is?
Yes, American Sign Language. You're welcome, and I apologize for acronyms.
No worries, we'll ask, don't worry.
That's great. So those are two areas where I see where this compact could be very helpful. A third area is in audiology. We have a small number of pediatric audiologists and in general audiologists in the state. So sometimes diagnostic evaluations are pushed out 2 to 3 months. And the goals of programs are ensuring that infants are identified are screened by 1 month of age, have a diagnostic evaluation by 3 months of age, and enter early intervention by 6 months of age. So it's a very tight time frame. So this would open up the potential also for some telehealth audiology services. I think that would be very, very beneficial to our state. And the last point I want to make is about the licensing that you've had a few questions. So this year we hired 2 staff members, one of which is a teacher of the deaf and an audiologist. And she had to be licensed in her home state of New York because she lives in New York in both areas. And then she had to be licensed in the state of Vermont in order to practice here as well. We have another employee, staff member on our leadership team who is an SLP and an audiologist. And she is licensed by AOE as an SLP.
AOE is the Agency of Education.
She's licensed by OPR as an audiologist. And so it's just, being able to have some flexibility would be really helpful. But thank you so much. Are there any questions that I can answer?
Art, I know you had a question.
Yes, I'm interested in the SLP being able to done via telehealth. Is that doable with that profession?
Yes, it is. And because of COVID-19 and the pandemic, we had to, obviously it's more challenging with children who are birthed to 3 years of age. It's easier with older students, but we had to pivot during COVID-19 and all of our early intervention services were done virtually. But one of the challenges that we have is that we only have one SLP certified in listening and spoken language. So we have several over the country that can provide those services.
That's why I asked.
So yes, and it's always, what we've done is now balanced in our program so that SLP services can be partially virtually and partially in person. And there are ways that we would be creative in ensuring those families had that time in person as well.
So someone in another state that's in the compact could get in a video, a Zoom type thing with a child, maybe with a parent or someone, and work through what they needed to work through. Is that how that would kind of work?
Correct. And work with the family or in collaboration with other providers like a teacher of the deaf who's also working with a birth to 3 child. They could do it together. But the specialty of listening and spoken language is a little more challenging to find certified providers in that area.
And that's what this would help with.
Yes, it absolutely would help with that.
Leslie? I'm just trying to understand the tension between the master's and the PhD or D, or I'm not sure.
Doctorate, you're fine.
Whatever.
Yes.
Okay, great. But you have an EDD. That would not qualify you from a licensure point of view to get the doctorate in speech and language world?
So it's in audiology, but
Your EDD is in audiology, so in that case it would, I guess.
right, even though it's in education, it was focused on
So it could
audiology.
be broader
Right.
than just that practice doctorate.
Yes,
And I'm just trying to understand that problem. Thank you.
you're very welcome.
So I have a quick question. So your first three examples were really around staffing. So in your assessment, entering into this compact could help that because either it would be easier to recruit people or you could use telehealth and connect with specialists in compact states. Is that correct?
It would be a combination.
Okay.
I think it would be easier to recruit if someone knew they didn't have to come in and obtain yet another, another license. It's flexible. And then we could also take advantage of the virtual telehealth piece. I mean, telehealth is appropriate for some children, not for others, but it would be certainly be to our benefit in Vermont.
Okay.
And can I just comment one more, which is
And we have another question too.
not related to audiology and speech and language. There are many of our professions that we are challenged here in Vermont for finding services.
Curiosity. The other states that are in the compact already, are they having problems finding people within their state to provide these services?
That's a hard one for me to answer. I know that at the national level, we're all being challenged because, and I'll give audiology as an example, there are less audiologists going into the field than are retiring from the field. And I think that is something we're challenged with. But if there's flexibility state to state and there's opportunities for telehealth, I think that we may be able to better use the resources we have available in the other states as well.
And if we're not part of the compact, and many other states are, we're at a disadvantage potentially in attracting people.
Exactly.
Great. Thank you so much.
You're very welcome.
Linda. Sierra?
Oh,
Hi, how are you?
good, how are you?
Good. You will introduce yourself and then go right ahead.
So my name is Sierra Downs. My pronouns are she and they. I'm a speech language pathologist with a master's degree in speech language pathology. That is the requirement for speech language pathologists, although the doctorate may or may not become an issue in the future. So I currently have a private practice in Burlington. I primarily specialize in voice, upper airway disorders, swallowing disorders. And I also work with the gender affirming voice training population. So transgender, non-binary, gender non-conforming. And I do contract work with Dartmouth Hitchcock for their head and neck cancer population and NVRH, the Northeast Kingdom for their specialized voice patients. So those are done virtually. A lot of pivoting since 2020. So we've learned a lot about telehealth. I'm going to go ahead and go into my spiel here.
Please, that'd be great. Thank you.
Yeah, so first of all, I'm so honored to be here on behalf of all of my dedicated colleagues, audiology, speech pathology, SLP assistants. We have a very broad scope of practice and a lot of very highly specialized folks in the state and outside of the state of Vermont too. But the demand for services for SLPs and audiologists, and this is through ASHA, it's just continually on the rise. And this is not just in Vermont. Estimated projections for SLP job growth is currently at 21% through 2024, with audiology colleagues not far behind at about 13% through 2029. Now, to consider the demand through a more local lens, I'd like to bring up a more humbling quote from our past president of the Vermont Speech Language Hearing Association, Danielle Kent. Early intervention services are in crisis here in Vermont. And I think we've touched on that earlier today with Linda and Susan. But in fact, there are just so few available providers. That's providers who are not already maxed out with seeing children 0 through 3. That wait lists are often months long, if not longer, or those children and their caregivers just do not seek services at all. And like Linda said, although teletherapy is a possibility, which is great, and it's appropriate for older children, it's just not necessarily appropriate for direct intervention for infants and toddlers ages birth to 3. So their caregivers, unfortunately, are just left in the dark in terms of how to best support their child's communication, development, and related areas of speech and language. But those barriers to accessing services, they continue throughout the lifespan too, right? So as language pathologists and audiologists, we work from 0 to, 124 if you live that long. So our adult and geriatric patients, they struggle to locate Vermont licensed providers during very crucial periods of rehabilitation. So my practice, for example, I have a few months long waiting list for patients who have experienced traumatic brain injury or stroke. Just since the pandemic, that lack of credentialed and trained providers for their specific areas of the field, especially as a medical speech pathologist, is just very small. So those barriers to accessing healthcare are, as we know, especially common in more rural areas, which is a big portion of our state. ASHA put out a survey recently that found that 44% of SLPs in rural areas were more likely to report funded yet unfilled positions when compared to SLPs elsewhere in the state. So I'm sure that doesn't, come as a surprise to any of us here. And although access to services is a known difficulty across our state, H86 would thankfully offer a solution by allowing more licensed providers to offer services in a cost-effective and sustainable manner. In terms of the success with the Interstate Compact so far, our neighbor to the east, New Hampshire, obviously they were the 15th state to pass the Interstate Compact. Those effects are likely to be seen, those positive effects are likely to be seen almost immediately. And on a more hopeful note, part of why I'm here, so removing these barriers to accessing services, whether it's accessing services from specialists outside of the state of Vermont, right, for more complex or higher complexity patients, or just filling jobs within the state, telehealth in person or otherwise. H86 could prevent substantial developmental delays for our younger populations, and it can also reduce medical risks and associated socio-emotional complications for our adult and geriatric folks. But among our professionals and the people that we serve, there's a growing urgency, and I think we've noted this as the Vermont Speech and Hearing Association from our members, that there's an urgency to remove these somewhat arbitrary barriers right now, and honestly, as soon as we possibly can. So I'm happy to answer any questions, but thank you for your time.
Great, thank you very much. That was wonderful. Any questions? Daisy?
Mine isn't specific to the policy, but about the field.
I have one like that too.
Go ahead.
One, thank you for your work. I think what SLPs do is amazing, and myself and my children have you to thank for their help. Are you seeing many long COVID patients in your field?
Yes. So since COVID, right, and I established the program through Northeastern Vermont Regional Hospital starting in April of 2020. So very interesting time to start a program. But since then, we've worked with our pulmonologist through that hospital, and I'm sure UVMC and Dartmouth has similar stories. Because long COVID affects the entire neurological system, we see issues with obviously chronic coughs, that's not a surprise, but issues with breathing disorders, which if you think about the speech system, everything starts down here, right? So I see a lot of folks with things like paradoxical vocal fold motion, which is a big fancy term for you're doing something relatively, normal, and all of a sudden you just can't breathe, right? It might be exercise induced or just anxiety causing, right? And those are things that we're seeing more frequently since COVID. And there has been a relationship between those disorders, whether it's a voice or swallowing disorders, have become more not popular, that's not the right word, but more prevalent, unfortunately. So really making sure that we have access, and of course I'm going to bring this back around to the compact, making sure that we have access to specialists if we don't have enough swallowing specialists in the state to address those more specific complex cases is so important. We have very few professionals in the state who specialize in certain areas. And the majority of them are very burnt out, right? Because we're being asked to be more generalists and not practicing at the top of our licenses. So there's a need here. But there's also cognitive issues, memory issues, brain fog. We do a lot as speech pathologists, but yeah.
Ryan and then Art, and then we have another witness.
Yeah, I feel like I could Google this, but it's good to engage you publicly and have the voice of a worker on the record anyway, so I'll ask this in a minute. But do audiologists treat tinnitus?
They do.
Is that covered by insurance, or is that something that
Yeah, and I feel like Linda or my audiology specific colleagues would be able to answer this more thoroughly. So perhaps Linda can come back up and answer that, but quickly.
Yeah.
Yes.
It's covered by insurance?
Yeah.
Art?
Yes, I'm wondering, you said that certainly for young children, and I asked a question on the telehealth before, but you need to get young children in person and to see them, and I totally understand that. Given the fact that New Hampshire is the only state in our region that has this, if we enact this, and I'm not saying it's a bad thing, I think it's a good thing, but we really see a rush of people to come to Vermont to practice. I'm sure if you talk to these folks in New Hampshire, they're probably right up to here with work too. I just wonder what benefit we're going to see in the short run from the compact, if any.
Well, I think speaking from a telehealth perspective, right, since we had, and forgive me, I forget the title or the name of the bill was H566.
Yeah, right.
Oh, yeah, something like that.
Since that's been enacted, we have a bit more, understanding of how much that telehealth access helps with providing more jobs, right? So more specialists who are willing to see patients in Vermont through telehealth. But physically, I don't think it's a bad idea to open that up.
No, I understand it's probably a real good idea, but I don't see it happening in a great number. To say that you're overworked and your staff's burnt out, I think they'll still be burnt out 2 years into a compact, unless like New Hampshire, New York, and maybe Mass jump into it too. I don't know.
Yeah, it's hard to speculate without having that that route available.
No, I get it. I understand. Yeah.
Thank you for your question.
Yeah.
Great. Thank you very much, Sierra, for your time and your testimony and your work.
Thank you.
I'm going to apologize now if I might say this name wrong. Lakshmi. Hi.
Hi, I can introduce myself and say it properly if you'd
Please.
Hello, my name is Lakshmi Joshi Boyle. It's Lakshmi. I say it's luck with a shmi, if that's helpful to you.
Lakshmi. I like that. Great. Thank you.
There you go.
And if you want to go ahead on with your testimony, that would be great.
Sure. So good afternoon. I am honored to be asked to testify on behalf of the speech language pathologists in the state of Vermont. I have worked at the University of Vermont Medical Center for over 35 years. And I've been a supervisor for the past 20 or more years. I have never had such difficulty hiring qualified speech language pathologists as I do now. We currently have 3 full-time openings, and we are struggling to provide patient care. We, as speech language pathologists in the medical field, as Sierra commented, we are on the verge of burnout, as we have been the backbone of medical care throughout the pandemic for those people who've had COVID, who have been suffering from difficulty with swallowing, breathing, as well as with long-term effects of COVID that have impacted their memory and their cognitive function and their ability to speak, people with trachs and vents. And we have been on the front lines with that throughout this pandemic. We could not close or postpone these patients' care. So we have been exposed quite frequently. Now, my supervisory colleagues and I are suffering from hiring and filling positions. I can tell you we just hired a traveler a few months ago, and when she heard that the Interstate Compact Bill was up for legislative review, she was thrilled because she said that even getting travelers into the state would be much easier with an intercompact bill. What's unique about her situation, and which I appreciate, I think it was Art potentially who asked about getting speech language pathologists into this state. I think once SLPs get here, they love it. And so with that in mind, we were able to convince a traveler to actually shift to permanent status to work at our hospital full time. I consider that a great coup, actually.
That's great.
Yeah, it was huge, and just shows how great of a place it is to work because she's even worked in, California and Hawaii. And by the way, I'm speaking to you from Utah, just to let you know. I'm here for a few days holiday.
Nice.
So from a patient care perspective, the last several years have impacted patients in ways that are unimaginable, with less access than in the past due to the pandemic and the restrictions that this imposed on patients needing care. I think we all probably experienced the last several years of having your appointments canceled because you had had an exposure to COVID, or you may have had been surrounded by someone who had had COVID, whether you knew it or not. And so thank you for passing of the telepractice bill, because that really made a difference in being able to see folks via telepractice and getting their needs met, even though they could not appear in person. I think what is important to know is that the licensing regulations differ greatly across state lines. And so when someone needs a speech language pathologist or audiologist, when they need to apply to yet another licensure, that in and of itself is a barrier because of the cost and the time and the effort and all of the regulatory somersaults that need to take place in order to become licensed in a different state. So with that in mind, I just think that Vermont can be a model and a cheerleader, if you will, for this interstate compact in passing it, because I think that we have, been nationally pretty amazing for this, little small state of Vermont. So I hope that we as Vermonters can demonstrate its confidence in the alliance between states to influencing neighboring states to do the same. As a primary level 1 trauma center in Vermont that also serves Northern New York, and as the only nationally accredited ALS center in the state of Vermont, we often provide care to patients from Northern New York. ALS, as some of you may know, is a devastating disease which impacts a patient's ability to communicate and swallow. Respiratory deterioration is often a hallmark of the disease, requiring equipment that is cumbersome to pack and carry. That, combined with the need for suctioning, the patient's portable, quote unquote, communication device that is often quite heavy, their oxygen or ventilation system, and their cough assist device can make travel really almost impossible for patients to be seen in person at our ALS center. Sorry, I lost my place for a minute. Without great preparation on the part of the patient's caregiver, this requires extra hands for lifting in order to put all the equipment in the car, as well as for the equipment to be attached to a battery in the car itself to continue to provide life, because these pieces of equipment are truly life-sustaining. The sheer act of these actions is deterring for the patient and family to come to our ALS clinic in Vermont. And these patients then and families forego the specialized care. I think it's important for us as Vermonters to realize that we're a strong level 1 trauma center for Northern New York. And so with that in mind, I feel like having the ability for speech language pathologists to provide skill services to evaluate and treat their patients' swallowing dysfunction and or communication would greatly lessen the stress for these patients, and we would be able to quickly provide quality of life measures in the comfort of a patient's own home, and would ease access for patients and with skilled SLPs whose expertise is actually in the disease itself. So passing H86, I think, again, proves and acts as a model of care. We also see a lot of infants and children, and the infants and children who we serve are having difficulties with feeding and swallowing based on their disposition at birth, such as those who are born with opioid addiction. Babies born with this addiction are already starting from a disadvantaged position. We have seen time and again that this disposition, in combination with their socioeconomic status and the emotional status of the caregiver, lend itself to canceled appointments because, for example, they cannot find a babysitter for their other children, or they do not have transportation, they cannot pay for gas, as all important examples. Being able to practice across state lines would readily allow for us as speech language pathologists as a whole to provide treatment within a child's home, but also via telepractice, creating a less stressful environment for all concerned, as the child would be in a familiar surroundings. And those of you that have children, you know, you can never get your child to do what you want when they want them to. when they're not at home. And you can say, I swear they were doing this before, but they're not. It would also make for smoother appointments, as the caregiver would have all of the child's feeding utensils, bottles, seating, and all of that, rather than what often happens is that they forget those things at home when they come to their appointments at the hospital. And the foods that they're able to provide, again, would be just way more familiar to the child because they would be able to provide that from their home. So I feel like, and I realize that the appeal is for an interstate compact that, as Vermont is considering passing it, it really is in our best interest for New York to pass it as well, to be able to have this, two-way street. So now I can certainly pause and take questions.
Great, thank you. Anyone have any questions? It's very good information, and I appreciate the ALS component of it, because I think that's important for us to remember. All right, I think we're good. Oh, Brian?
I mean, I'm curious, it's not like an essential question, but since there's no questions, I'll ask it. Because I'm curious, like, what the general compensation is for the services that are provided by your profession, like the range, like what would, like when someone comes in for a very basic thing, how much it costs, and like for more complex stuff, because we are trying to tackle the issue of like access to healthcare, and I know some patients have high deductibles, and I'm assuming this is a specialty, so they probably have, some people have to pay for it out of pocket, even if it's deductible. So I'm curious, like what the range is, and it could be like a ballpark figure.
So that is probably $1 million question. And the reason for that is because everybody has such different insurances, and because I'll just say the hospital in and of itself is in this constant mode of negotiating with different insurance companies, it makes it really difficult. But what I will say is this: our charge that we charge is service driven. It is not unit based for almost all procedures that a speech language pathologist conducts. So what that means is that if we spend 15 minutes with a patient, or if we spend an hour and a half with a patient, the charge is the same, which frankly allows us to provide the quality that the person needs, and we can spend the time with the patient that is needed, without a person like checking their watch and wondering, oh my God, how much is this more going to cost me? Because it costs the same regardless of time spent.
Great, thank you. Great, enjoy Utah.
Thank you very much.
Thank you.
Take care, all.
Thank you.
Luckily, we don't need a compact to hear testimony from across.
Right, I know. That would,
Bye-bye.
that would slow things up. So let's just do a quick committee discussion on this. I want to see where everyone is. So we've heard the counseling compact, the PT compact, the audiology compact, understanding there's still some work between OPR and Legislative Council to do on an amendment for the background checks, and to maybe change some of the effective dates. But what are people thinking about supporting this? Is there more we need to hear? More testimony you're looking for? Art?
I would like to hear, if we know it, something about the fees, how much the cost will be. Not that it's going to change my mind. I generally support all of them, but it would be nice to know what it costs and what benefit we're going to get, or what we foresee as a benefit, if that's at all possible. So
we could provide you the fees that we charge to get a state of Vermont license.
But are we going to have to put on 2 people at OPR to do all this, or?
So let's direct that specific question to OPR.
Are we going to have to put on, oh no, go ahead.
No, again, Lauren Hibbert, Deputy Secretary of State for the record. I do not anticipate that we would need to hire new staff for implementation of any of these contracts.
Okay.
So there will not be a revenue ask if we pass these up.
There will not be a
appropriation. There'll be a fee discussion with Ways and Means.
I want to be careful in how I respond to this question. There will not be a request for more positions created through DHR. There could be a revenue request from the general fund to support our work under compacts. But at this moment, it's particularly focused on increasing fees on license fees to cover the work of the compacts and the loss of revenue from joining the compact.
And that will be a discussion like we had with the nursing one across the hall in Ways and Means.
But it would be nice to know that.
So the process would be, we would vote this out so that the bill could physically go to Ways and Means and they can have the conversation.
Okay.
And then at that point, we would know more from Ways and Means. Maureen, and then Leslie. You good? Leslie?
I am very for all these compacts. I want to expand our workforce and any access that we may have, because I think we've heard pretty clearly that we need to. I think that there are probably unknowns and there may be things we wish we knew, and that will become clear. And I think that anything, and you can tell me if I'm wrong, that needs to be amended can be amended as we move forward. Is that not the compact itself, I understand, but as we need to take action as a state, that we will have an opportunity to do that. So I just want to say that I'm for it. I'm for them, not it.
Thank you.
And I just want to respond that I think that is true. The financial implications have to be dealt with at some point, and that is where we are with the nurse compact. So while this office is not recommending removing ourselves from the nurse compact, we absolutely have had a financial impact, and now we need to deal with that financial impact, and we're asking the legislature for help with that. So it is possible that, as compacts move through all of our professions, and again, back to my original testimony last week, and then earlier this afternoon on the PT compact, there is good public policy for implementation of the compacts. There's also a financial impact. For the physical therapists, I think we don't at this moment, but we can have a better sense of the fiscal impacts to our office. For the counseling compact and for the audiology and SLP compact, there's more unknown, and I agree with you. We may just have to be comfortable with that unknown and know that we're going to figure it out in the future because the policy is a good policy.
If I may, I think, I'm not sure it's realistic to have this whole thing stand on fees, and that may not be practical. And I don't know how it is in other states necessarily, and I don't know if that's going to help us. But that's a question for me. It just not be practical, and that we need to support our professions in spite of needing to support OPR do their job.
And so that is a question that is being asked and will be taken up again across the hall. So this is the policy, very similar to when we did the telehealth last session with 654 and 655, where we set the policy and then there was an appropriation ask to get that off the ground that went to appropriations and a decision was made there. And I think we've heard, a couple times just in the testimony today, how valuable that legislation that came out of, this room really has been for providers and patients in Vermont. So it is hard to put forth a policy and still know there's some unknowns, especially if there might be financial unknowns, but we're the policy people. Lisa.
Oh, so I just wanted to say that I'm fully in support of this. And I think we talked about one last year and we had a lot of questions around it. And I found that my questions and my reservations have dissipated with all of these occupations. This is the wave of the future. Think about all the work we did on telehealth last year. These were the things we were imagining would be possible.
Right.
Well, these compacts actually make the work that we did possible. And I would much rather us be, I was going to say one of the beginning states, but we're not. We're behind on this. And to Lauren's point, I'm not insensitive to the costs of these and the fees, but as we move more towards this type of professional regulation, maybe we need to be rethinking and reimagining how we how we are paying for that. And I think that's, conversations in the future. I don't think we should stick with maybe the old ways of just, here's the fee and that's what it costs. Maybe we should start, to Leslie's point, reimagining how we support these essential occupations.
Thank you. Frank?
Yeah, I support these bills, and I support additional work to join any interstate compacts around healthcare as is feasible, and that I will continue to advocate for us to take any steps we can towards a unified universal healthcare system in the United States. And like interstate compacts are an important piece because then people could travel between states and get healthcare, on demand anywhere. And so this is an important step in that process. I understand the financial stuff's another story, but I wholeheartedly support this. And, if it's not perfect, we can fix it as we go, and it can get fixed in the Senate. And, so let's just get moving and move on to the next thing, like pass it.
Great, thank you.
I have a question that's not answered yet. And that question is there anybody in the room, anybody that's testified, know whether or not we're opening up a path so that we end up in a predicament like we are now with traveling nurses, where they charge an outrageous price for their services? Are we opening up that path by doing this? Because it's ruining service delivery agencies here in Vermont.
I understand your concern, Representative, and none of these bills address specifically traveler costs or use of travelers. They will enable people to come here on a contract basis to provide services. And if the facilities were in this room, which they're not, but and some of the employees of facilities are here, they would tell you that they're having an incredibly hard time recruiting from within our borders, that the only solution is to utilize travelers. And the fiscal impacts are complicated and not appreciated by the hospitals either. So I think we're just in a really tricky situation with regard to who we have in our state and who we can bring into our state, who we can recruit to stay, and how. I mean, I have heard stories like the story you heard today of a traveler coming and then staying, and I just want to give like a big fist pump to whenever that can happen, right? Like that's when we've done our job well. I think there's a really good story to tell about who we are as a healthcare community in Vermont. I'm not part of the community, but I sometimes speak on behalf of it. Who we are as a healthcare community, I think we have advantages here that are not in other states. We have a compelling story about what it means to live in Vermont, but I don't think it's a licensing fee or the regulatory structure for licensing that creates barriers for people to live here. I think it's much bigger than that. I think it's related to housing and childcare primarily. Those are the main reasons I hear that people are not moving to Vermont who are healthcare professionals. And a compact isn't going to solve that, and travelers will have to be utilized until that's changed in some way. So I don't know if that answers your question. And I probably
It does to a certain extent, but I don't want to set us up to fail. And see agencies that are providing good services now go down the tube because we have to pay a lot more money than we're paying now for people that are here working. That's what I'm worried about. And that's why I asked the question, are we opening up a pathway for the same thing to happen? What's happening with the nurses?
So what I can tell you is before the nurse compact and after the nurse compact, the traveling agencies would pay for their licensees, their nurse to come into the state to work. So it was not a barrier for the traveling companies to get a license in Vermont, a nurse license for their employee to come work in Vermont. That was not a barrier. It made it faster for them to bring it in, to bring their traveler nurse in, but the licensure fee did not give them pause. It's a very small amount of money in the whole scale of this economy. And again, I'm not an expert in the economy of the traveling healthcare professionals, but.
Sarah.
Representative, I just want to paint a little bit of a picture in terms of traveling SLPs, although I can't speak to traveling audiologists because I am not one. I have been a traveling SLP in the past. I've worked in Boston and DC and Maryland and New Jersey, and the states that have more rural populations tend to have to pay more because they have fewer SLPs out there that are licensed in their state, and there's more of an urgency, there's more of a need. So when there's less barriers to gaining out-of-state licenses, so let's say I lived and worked in New Hampshire, I had my New Hampshire license, but I also was considering a contract job in Vermont. The more of us that have Vermont licensure and the more of us that have barriers to accessing that without having to pay for transcripts and go through all of those steps, I don't see that being equivalent to what's happening, right, post-COVID with nursing. We're also a very different, diverse field, so we're working in school systems as well. So I agree, it's not quite equivalent to that situation, and it's also much of a bigger scale, complex issue when it comes to traveling contracts and the pricing that goes into that. But yeah, rural areas do tend to have to pay more because there are fewer of us who really want to get licenses in rural states because of all of those barriers that exist right now. Compact would help with that.
All right. Thank you, Sarah.
I support all the compacts. I support the move towards allowing more healthcare workers to work where they can, where there's a need. I support the travelers, whether nurses or other professions that help us in the healthcare field. My characterization of the need for travelers is not about the individual professions or professionals that are doing the traveling. It's about a system, that is under incredible stress for many reasons, because of the pandemic, because of the aging of our healthcare workforce, that is creating a need for more healthcare workers of the kind that we've been taking testimony about. And just a side note, we have an occupational therapy compact bill as well that's been introduced. So we'll have lots of practice by then for that one. And traveling staff, and I apologize to the chair, going to speak as a nurse who has gotten a compact license and traveled. We often take on significantly more risk. And during the pandemic, we were the ones that took care of a lot of really sick COVID patients. We uproot ourselves, we disrupt our families, our lives. So for a healthcare system that has, for whatever reason, over many decades, undervalued healthcare workers, and speaking as a nurse, undervalued nurses in terms of remuneration, I would not characterize travel staff as being the problem.
The staff themselves, no, it's a systematic problem.
Plus there are issues with recruiting agencies that the federal government is looking at as well.
Right, we need, no one wants to be paying, we need to staff our healthcare facilities. We need travelers to do that right now. We hope that some of those travelers will come and stay and live in Vermont, and we can make them Vermont residents. And we hope that the federal government is working to help us control the costs of this process, because that's where the real issue is the amount of money we have to pay for the travelers. It's not the travelers themselves. Daisy.
Stepping away from the traveling providers. I support all of the compacts and all of the providers providing those services. I have used all of them. And as someone who is a new Vermonter, that brought my children here to raise them here, I think that we need to provide better access to Vermonters. And I think these compacts really do that. I think it, you know, from what I've learned, they solve a workforce crisis, or they help address the workforce crisis. They also help address the access to healthcare that we need, you know, and all of these treat, you know, across the age spectrum. They treat my kids, they treat me, they treat the grandparents. And so I think this is something that I can get behind for those simple reasons.
I will say for the record, I also support the compacts. I think they're necessary. Like Topper, I worry about the unintended consequences. And I was sent down here to look out for Vermonters, and I want to make sure it's in our favor.
Great.
But I do support the compact.
Great, thank you, Alan. All right, we will come back to this. I wanted to have that conversation because I wanted to make sure we had some support moving forward, so I can ask Legislative Council and OPR to work together on the amendments that we need for these, and then bring them back to us and for a final discussion and a vote when they're ready. So let's plan on doing that. Great. Thank you, everyone on the screen, in the room. Yes. We're still on air.
Before they go.
Okay. On air or off air? Oh, yes. We have one more thing. Yes. So let me just finish. So everyone that was here from the compacts, thank you very much. We're going to actually move on to other committee business.
The guiding principles. We have to Wednesday. And Brian, Daisy, and Mary.
I'll send it to you right now.
Okay.
Send it to me. Send it to you.
Yeah, okay.
And I have some edits I'm going to send you tonight too.
And you have some things
Yes, I have
that you
some
want to
things
give
too.
us?
Yes. Great. So we are back here tomorrow morning at 9 a.m. Or I have no idea. So let's just make it a surprise when we come back at 9 a.m. Yes.
Do you anticipate, like I'm looking at the agenda for tomorrow and it says we have 9 a.m.
What do we have?
It says Act 85, review and discussion.
Oh, right. COVID flexibilities.
And it's 9 a.m. until noon with no break or anything.
Oh, we'll do it. Yes.
And I have to squeeze a phone call in. Is there a time you'd suggest, or can I just kind of make the time and?
I would say be here for the first hour and a half would be excellent.
So after
let's
10:30,
say
thank you,
10,
that's
yes.
perfect. I just want a little direction.
We'll take a break around that time.
All right.
Yeah. Great. Thank you, everyone.